get things started. Make it hopefully fun, entertaining. Anyone seen me before do my lecture? Good. Do same stand-up comedy then. That's the plan today. You guys are all chiropractors. You guys know what you're doing. This is what it comes down to. I'm going to show a couple videos. In my talk, I do a lot of adjusting. We see in my office, my partner and I see about 300 people a week. That's our normal average. Yesterday we saw 85. Make sure my staff told me before I left. We're adjusting chiropractors. We do a lot of hands-on, full body from 1, 2. We take extras in our office. I'm in Upland, California, if you know where it is, by Ontario Airport up there. And a lot of it is just getting to see people and getting your hands on bodies. That's all it comes down to. I have a lot of interns come to my office. I either want to become a chiropractor or in the healthcare field. I tell them a lot about communication. Yes?
Really quick,
Sure.
sorry about that. We are going to go through your breaks.
Yeah.
So if
There's
anybody needs to get up and go to the bathroom, it's going to be down the hall to the left. Coffee, they sell coffee here at Starbucks. If you want to grab some, you can. Just get up, come right back, or if you need to stretch or something, because as I stated, because we are cutting it short, you guys need to, we're going to have to go through your breaks, and then I'll cut your lunch a little bit shorter as well, but we'll be okay. Okay?
We'll be fine.
Thank you.
A lot of it is we're going to try and get you guys in and out of here. Make sure it's not as boring as hopefully you expected or not. We want to make sure you're having fun, you know? As chiropractors, we know the biggest thing in our profession is communication. That's what we do, right? A lot of it is people come to our offices 2025, they still don't know what chiropractic is. They have no idea. They think we're a massage therapist. How many people say this year so far have had someone ask you for medications? I have. You know, like, when you met, I'm like, not really, you know? So it's almost like we have to educate our patients from ground one, from step one, sometimes to where we want them to get to. We want them to stay healthy. That's the plan. And to get there, everybody's different. How they want to communicate, how they learn is going to be different too. So my job in my office and my chiropractors and my interns and hope future chiropractors too is teach them the basic communication. We're going to break down some of that, as you guys already know, and really understand how people want to learn. You know, some people learn by visual, some by auditory, some by touch, some by smell. So it's almost like figure out how they learn and go from there. What's the first way people usually contact you or your office? I almost go, my talk is more like pre-adjustment, adjustment, post-adjustment, and lifestyle. That's how I kind of work my things. How do people contact you? What's the number one way they find you? They're like, do you have a billboard on the street? Come and see me. YouTube, Google reviews, Yelp reviews, word of mouth, huge, right? That's the biggest thing in the world. And I always make sure every month I can list my patients for my staff, who came in this year, who came in this month, new patients, where they come from. And also, and that's my biggest thing is where do they come from, referrals from other people or from Google, from Yelp, or from somewhere else, or off the street per se. So you want to make sure, if I do that, tells me, are we doing a good job? What I mean by that is, if I'm doing a good job, that means that I'm getting a lot of people that come in from other patients already. And when they do that, they already know what to expect in your office, which makes my job easier. When someone comes in, no idea what we do, just found us our Google reviews, Yelp reviews, does they ever tell you that, hey, I came in from your reviews, and they ever ask you why you have so many good reviews? Why do they ask you? What do you say when they ask you that?
I'm awesome.
What's that? Good. I like the confidence. Do you ever say, well, I know where they all live. They're all my patients. If they don't give me a good review, I'll come and find them. You know? Have fun with it sometimes, as much as you can. And when someone communicates, we'll go in a second, but I'm going to show some videos, a couple of my videos from a couple years ago of just patient results. Get you guys kind of warmed up a little bit. All right? Get things started. Piece of cake, easy. I like the confidence, though. So here we go.
Ever since I started coming to the chiropractors, it's made a difference in how I sit down at a desk and also how I work out. I'm able to have better positions in posture, sitting down and doing exercises, squats, something I've never done.
Right. Now, well, why I recommend you guys sit down, because now the things that I do is when, because I'm sick or so, it's like I need to get my fixing, and I gotta get
Crazy
snapped
guy.
back and I'm bopping.
Oh gosh, he's a funny character. I'm going to second. A lot of it is we know the results, right? We know how chiropractic works. Do we get the results? Yes. How do we get someone from day one when they come in the office to realize that can happen to them too? How do we communicate that? How do we give them that hope sometimes that they haven't had from other doctors, medical doctors, even some of the other chiropractors too? How do we give them the confidence? I take X-rays in my office, X-rays. That's what I do. I'm old school probably, but a lot of it is I want them to see and understand before I even put them on the table what we're going to do, what we're going to actually fix. Give them that visual of an X-ray, an EMG exam, whatever you want to use. Gets them that I won't call it medical, but the evidence to see that we do is actually not magical in the sense where there's nothing to back it up, even though that sometimes can be backed up too with science. So can we actually give someone if you want to call it the respect, to sit there with them and explain what it is? How many times do you get patients from other doctors, medical doctors specifically, that they say they go into a room, they've seen their doctor 10 times, 15 times for a new medication, a new drug, another shot, a referral here that didn't work. And they get to you, they're coming to you going, in their head, they're just desperate for help. What's a chronic pain? How many months does someone have to be in pain to be considered chronic, you think? 3, right? About three. So if they're in chronic pain, has that now, if you want, cause them to think differently, maybe cause other things besides the painful area of their back or neck to affect even their overall life? So can we get into that stuff too, to where we talked about, you have back pain. We know, you know that. We know that. It's in your charts, in your information. You have even some sciatica too, probably. But what else is bothering you? And then sometimes by listening to them how they talk, can that give you an idea how they're feeling also? So even without asking them about other things, do you monitor and perceive how they're talking, how they're sitting, their movement patterns, and understand that's part of how they communicate what they're going through? You guys know what something's called? It's called like attracts like. Heard that before? Somewhere in the universe? In a sense where if someone sits with their legs crossed, do you sit with your legs crossed also, just maybe subtly? To let them know you're like them, you're likable. If they talk in a high volume, do you start out talking with the same tone of voice as them? Do they talk at a fast pace? Same thing. Do you mimic some of that? It helps them understand, hey, I don't know who this person is yet. I may have referred here. My wife sent me in. My girlfriend sent me in. My boyfriend sent me in. Whatever it is, too. I don't know what's going on. But this person seems like I can talk to him or her. So by having that certain tone of voice, that mannerisms with your patients on day one, that first 5 minutes of communication allows them to see, I can trust this person. And when you build trust with someone, how does that help you become their chiropractor? Let them have a chance to get the adjustment to see the benefit, right? So we have the way to communicate with someone and talk to them. Do you do most of the talking in your office with your patients, or does the patient talk more than you? What's the goal? Is it 50-50, 49-51, 40-60? I want my patients to talk the whole time. I give them about probably 3 minutes of talking before I start. If I want to call it confirming it, whatever it is too. I want to hear their tone of voice, what kind of words they use, where they are, and how much they go back in time in their injury relative to where they feel right now. And also, do they talk about, my back pain caused me, I can't sleep. I can't play with my kids. I can't go to work. It affects my ability to actually work properly. I can't sit for long periods. I can't even drive to work a couple days a week too. So by telling you all these things, they're confessing, I say, to how you're going to help them get those things better, right? So once they're done talking, I always go, okay, our job is not just to take away the back pain. We want to make sure if we want anything, you sleep better. And they go, why is sleep important for people? How does sleep, insomnia, let's go back to that, how does that affect their overall health? Does it make them sometimes a little more sensitive to things? Sometimes I even bring it up too, sometimes you feel a little bit anxious. Did it ever cause anxiety? And then she'll go, yeah, by the way, I'm on anxiety medication also. Really, expected. Sometimes depression too, guys and girls. I had a patient a couple years ago. She is a nurse practitioner. She had been on medication for about 4 years. And finally her doctor said, you no longer have, it's not a physical problem, it's in your head. How many people have you known, patients, been told it's in your head, the pain's not in your back or your neck? A lot of people are told that. So since a psychologist, what happened? Doctor goes, you don't have a head problem. I don't know what's going on. Comes to the office, comes to the chiropractor, boom, 2 months, she's feeling 80% better. Can sleep, and that was her biggest thing, she couldn't sleep. She sleep for 2 hours a night. Can that help someone not feel good? 2 hours a night sleep? I can't do that. So by understanding where they are, where their problem came from, and the distance of the problem, does it help us understand how the adjustment may help them short-term, sleep better, long-term, take care of their back pain, long-term, make sure it doesn't come back. When someone comes in and goes, man, I had the pain for about 3 years now, you fixed my friend Sarah, can you just fix me in 1 day? You ever get that?
Yeah.
All the time. Or I get this one time, I love this one. This lady comes in all the time, I think it's Allison, comes in, my back's killing me, and sometimes she even forgets to bring her stuff in, and she goes, I'm going on a 2-week trip, can you fix me by tomorrow? I'm like, no, I can't. So you always get those ones where they want the quick fix, right? That's just part of life. You're gonna get, it's law of averages. You have people that are going to be perfect chiropractic patients and ones that are not going to be chiropractic patients. So can you kind of help everybody at wherever they are and give them that one extra step? Sometimes someone comes and goes, look, I just want an adjustment. I know my problem is. I've had this before. Just adjust me. I don't need x-rays. I need nothing else to. I'm like, yes, love to. But if it doesn't fix you, I want to see you back in a couple days. They come back a couple days like, man, it's not fixed. Yeah, it's not fixable yet. You've had it for 3 years. So it's almost like giving them a chance to, I want to call it hang themselves on their own beliefs and then come back and go, man, what is the real problem? I had one person, he's a really nice guy, teacher. He came in and goes, man, my arms feel a lot better. I think I'm going to hold off on care. And you go, okay, great. I go, great. He goes, what do you mean, no rebuttal? I'm like, no, nothing. I'm good. I have other people to see. Comes back a couple days later, arm pain's back, like you said it would come back. I'm like, yeah, I know. Lie down. Take care of you. It's almost, you have to give them that a chance to kind of do their own thing and go, yeah. And they're going to hit their head, going to say, doctor was right. Once you have that, then you got him. I've seen him for about probably 6 years now. You know, it's something to where when you give them a chance to kind of, it's called, what's it called? It's almost magnetic per se. When you give them a chance to kind of walk away, they're going to come back right away. So part of it too, again, the examination and like attracts like. Make sure we not mimic our patients, but can give them a chance to say their own F1 testimony. How many patients you hear call sciatica sciatica? Ever get that? I'm like, perfect, good. I always say, we're going to help your sciatica by doing this. Use their terminology. If they use certain words like, I feel depleted, I feel there's pressure in my back, I'll go, this is where the pressure is. I feel I have air in my neck. This is where the air is. I never correct patients the first day. Let them tell their story. Let them build that confidence. And once they get this, the adjustment, they go, then you got them. Then you go, okay, now what else can I do? And help them get better and better and better. So this is how I work my office. This is why this is someone I've seen Brenda for probably 3 years now. Comes for treatment. She works at UPS, so she knows what she needs. This is a quick adjustment. We just run. Simple, simple, simple.
Easy. Good, right here. Take a deep breath in. All the way out. Let that head drop, shoulder drop a little bit more too. There we go. Good. So cross your arms for me also. Right here. Take a deep breath in. All the way out. There. All the way out. One more time. Easy, right? Good. Sit on this side. Just let it
Easy, easy, easy. Boom, boom, boom.
So let it drop all the way down. And then hand up here. There we go. Breath in. All the way out, right? There we go. Good. Outside for two. Piece of cake. Right here too. Let that arm come up. Yeah, let's go. The leg drop for me too. Like the shoes. I like the shoes. Deep breath in. All the way out. Wow. Perfect. Back workout. Good work.
Boom, get to work. Boom, go, go, go. So they know when someone comes in like that, what they need, what they want, they lie down, boom, good to go. Easy, right? Day one with someone, how do you get them to get to that point? It's by training them. You know, they're not gonna, I had someone come in actually from San Diego, my office a couple years ago, and I was like, got the adjustment done, we're good, because she can chiropractic before. Goes, well, what else are you gonna do? I'm like, what else does your chiropractor normally do in San Diego? I go, well, spends like 20 minutes with me. I'm like, doing what? Talking about the news or something? I don't know. I want to see people. So when someone learns that their treatment is done, they go back to work, back home, whatever it is too, you're not wasting your time either, right? I mean, does that make sense? I mean, I don't want to talk about other stuff with people. I just want to treat them and go. If some of your senior patients, right, senior patients that want to tell, they always go, they want to tell their story and they go, and then I'm like, no more and then, just go already, please. Do you have a 5-minute rule in your office? If you have staff, 5-minute rule, you know what that is? You don't have that? Oh. It's where your staff knows if you're with a patient more than 5 minutes, you've done your job already, you're done. They know you're done. So find a reason to get you out of the room or give you a chance to get out of the room. Sometimes you have patients that want to talk to you and tell their story, what they're going on in their life, their family, their kids, their future, everything else too. Do you want to hear that every patient? I don't. You know, I have my own life to live. So my staff knows in 5 minutes, if I'm not out, they go, Doc, there's a phone call by attorney so-and-so for you about that case. Do you want to take it right now or do you want to wait? Okay, I'll be right there. Give me 1 second. So they know you're busy. They know you're not wasting time. If you have closed doors in your room for your patients, do you leave the door open a little bit? So at that point, it's obviously just a liability issue for one, but also they see people walking back and forth and know you're busy. They know they're not the only person in the office. And also giving that, if you want to call it, you have time for them, but not all time in the world for them, gives you that ability to move on to the next person or do your own little thing. You know? So I have that 5-minute rule with everywhere I go because I want people to understand I'm busy too. You have someone that comes in your office, especially if they come in often, and they complain about everything, their life, their family, their back, their neck, their blah, blah, blah. I had one person come in and she started laughing because I said, man, you have all these problems, but your hair looks really good. Give them a little compliment here and there. Just kind of throw them off a little bit. You know, it kind of gets you, changes the mood, you know? My goal with every patient, I'll go over at the very end too, I think I have something by my door when I leave, is make sure every patient leaves happy. If they get an adjustment, not get an adjustment, just come in for a quick consultation, I don't care. If they leave happy, that's all I want them to experience. You know, maybe something I can tell them or something, I don't know. So, next thing here, another quick one, boom, boom, boom. Wasting time, we just go. Another UPS employee. And a Charger fan, too, I don't know why. Boom, 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 let's go. Sure you are, Anthony. Quick stretch. Jump on them and go. You guys do a seated cervical adjustment too? So beneficial for headaches. Love it. Scares the crap out of patients though, doesn't it? It's so loud sometimes. Like, ugh, crazy. So, and when you adjust someone, what's the 3 or 4 things you expect their reaction might be? What's a normal reaction for a patient for the first adjustment? What do you usually do, or what do they usually say?
Surprise, shock.
Like shock, like what the heck? Sometimes they laugh, right? Sometimes they cry, release emotions. Sometimes they have Tourette's. They say a bad word or something. Sometimes they speak different languages. It's like a deep possession or something. So I always like, if there's a family member in the room with them, I always kind of prep them like, hey, this may happen, may not happen. We'll kind of see what kind of reaction you're going to have. So having that, if it's possible, and again, every patient's different, that first treatment, get that energy, or get that anxiety to a little bit lower level? Does it help you as a chiropractor help them relax for you? How many patients they go like this, okay, ready up, doc, I'm ready. You go, no, you're not ready at all. So you want to make sure they have a chance to relax and even breathe. Maybe use breathing techniques with them. You ever use the foot one to help distract them? You ever do that? Perfect, right? You guys know that one? Where you're about to adjust their neck, right? And then all of a sudden you just say, bring your feet together. So where they're focused on not their neck, their feet. So bring their feet together, and you get them. Right? So you got to find a way to help them relax. So it's just part of getting them to get their first one out of the way, like the first time you rode a roller coaster for one, to get that anxiety, what's really that anxiety is really a false fear. At that point, they feel the benefit. That's the key, right? So what's the benefit of chiropractic? What would you say? What would your thing be? If they have, for example, neck pain, obviously relieves neck pain. But also, if you have headaches, if you have neuropathy for one too. How do you explain neuropathy to patients? How do you usually, is there a simple way to do it for patients? I use the 5-finger thing. It could be, neuropathy could be numbness, tingling, burning, sharp pain, or weakness. Do you have any of those things? Today, tomorrow, yesterday, last year? Yeah, I do. I have it in my neck when I wake up in the morning. Good, we know it's coming from the neck, going down the fingers. Let's fix the neck, get that better, so that goes away. I had someone come in this week. She hadn't seen it for about 2 years or so. Hand neuropathy from sleeping. She had stopped working out, had more sedentary job, made sense. She knew where to go. She came in, she got treated like this is why I come here, doc. Perfect. So teaching your patients today, day 1 or day 2 or day 3 allows them to long-term know why to come in to see you. Makes it so much easier, right? Makes your job easy. You can see a lot of people and not have to do anything. That's long-term key place. So next one. You ever do, this is a video with a work comp attorney. She wanted to explain to her patients, or her clients obviously, how chiropractic works. So walked with her a couple videos on neck adjustments, back adjustments, and low back adjustments, low back and mid back adjustments. So this is how I kind of explain to her and my community and my patients how I kind of break it down for people, especially my videos too.
Hi again, I'm Dr. Tony. This is Naomi. She's going to be my patient today. We're going to explain how the neck and the low back and the mid back adjustments go and how they work. By explaining our goal here is to make sure you feel comfortable when you come to the chiropractic office, what you should expect. Okay, the adjustments allows the bones to move. You may hear some popping, you may not hear some popping. By that movement, that popping releases pressure. Getting the pressure out of your spine, then your body can relax. Not only the muscles and joints, but also over time they can want to stay there. So your person's health improves, chiropractic natural flow. So I'm going to adjust, I'm going to turn around for a second, here, turn around this side. I'm going to show you exactly where we're going to adjust here in the neck first, however wide you have in a second. So I'm going to adjust these bones here at the base of the skull down to the shoulders here. Okay, that is your neck. You have 7 bones in your neck. You go from actually 8 to back to the skull all the way down to the top of the shoulders. Adjust here, move things around left and right over time by doing a quick cavitation left and right. Make things want to move better. Okay, when you're talking, may not hear talking, but those can cause more motion. Things that can stretch, make the motion stay there. Right? Take it on your back for me. So right here, all I'm going to do is have her, I'm going to have Naomi turn her head to the right, right? Doing that now exposes that left side of the neck. We're going to move these areas. I'm going to use this part of my hand right here, cause that contact with the bones of the spine. Means your shoulders are relaxed. She's breathing normally, she's not tensing up on me. Now when I get in here, take a deep breath in, all the way out, right here, move that lower side. Okay, we'll turn around on the side too. So make sure she's breathing normally, nice and relaxed. Shoulders relaxed, muscles not tension. Hold it right there. Take a deep breath in, all the way out, right there. That allows the bones to move normally. A very quick motion, but a very limited motion. So we're not going to rip the neck off. Muscles don't want to stretch.
Don't rip the neck off.
Stretch out.
Not a good idea. Good. So that's how I explain it. This is for her clients, and also she was training attorneys too, to explain chiropractic patients why they would want to see a chiropractor. So can you explain it do you explain, and I had problems when my grandma was alive with her doctors, is she went to UCLA for she had some heart issues. And the residents there, you thought UCLA residents, right? They're going to be high end, blah blah blah. They want to talk about everything at a medical language. These big words that my grandma's like, what are they talking about? I don't know. They're talking about different stuff versus talking to people like they want to be talked to, their language, their terminology, their vocabulary per se. So giving them that respect allows you not to talk over their head. Ever talk to a patient or seen someone like that if you go to a medical doctor or someone else or helping someone else as an advocate to go, you see like just during the headlights they're going like, what are they saying? You ever get that in your office too? I'm like, and I take a step back. Okay, give me 1 second. We need to do a reset. Let's figure out how we can communicate with you. Because we're sometimes the second doctor they're seeing. We're not their medical doctor. We're because they have a certain type of problem for one also. So we make sure we communicate at their level as much as we can so they get our message. Because once they get here, this is the easy part for most people. Once they get that, you go, okay, that's what I needed. But to get there, sometimes they have to be, I guess, communicated well or confirm what they're coming in for so they see the overall benefit. So go one more video. I'm going to skip this one. This is the middle back. Let's do the low back now. There we go. That's the middle. The low back. This is the low back one. Easy. A little bit louder too. Go low.
Allows areas to move. These bones here, they just give you rotation, but also your hips too. Second stand, full second stand up. In the hips itself, here, what happens is these hips can shift up or down, with causing it to pinch the actual spine curves. You make those areas when you adjust someone, yes, adjust the spine to move it, but also make sure those hips can more level. Not when the person stands and sits, with more of a level lower back, level tailbone, level hips and stuff. So put your stomach one time, put your stomach. I'm going to show you a quick assessment how we do that in about 15 to 20 seconds. And because these hips here are connected to the legs, check the leg length itself by coming down here, pull the legs slightly so they're more even. And over time, as you can see, those legs a little bit on the side, the left side a little bit shorter. Okay? That means that that leg is not shorter as you walk in a circle. That means that this hip is higher, this hip is lower. What that means also is not just the higher level hips or sectional vectors there, secondary motion. This hip comes higher and left in, causing rotation in front. The right leg being longer to have rotation to the back. Okay? So there's always secondary motion with the spine. So my job, because the spine is like this now, is to unlock it and shift it this way so the spine will be more level over time. Okay? So now you do first of all, I want to adjust the higher side first. And have you on your side facing me. Let's go right here. I'm going to adjust the spine here. My contact points will be yes the lower back, but also yes side at the same time because I have big hands. I can go on left. Okay? That gives one hand your leg off the table. Allows the more lower back to stretch and open up for me. Gets the adjustment started. And move it over to the person and have them take a deep breath in all the way out. Shoulders relax right there. Okay? It allows the joint to cavity. That was that pop was. Allows there to loosen out and frees up not the yes side joint, also lower back joints on both sides. You can switch sides also. Make sure you get both sides even. Now I'm going to do from here. Here, it's a little darker on this side. I want to contact that same side that I crossed the back. And now drop that arm down. There we go. Do that pressure also makes the hips more even. So put your stomach for one more time. I'm going to check here again. Keep adjusting it please when you cannot see what the results are. Okay. How's that little camera girl? Good. More level, right? It won't stay here. Okay, now from this point on, now that you know what the problem is, what I would do after the adjustment, after you adjusted this part along the mid back and neck, is now that you're adjusting up to make things my stable level. Our hips have learned, sometimes they're going to stay as that's very normal. You know, over time, down the line, as we coach them through the post-adjustment guidance, make the exercise back and make these hips more level so they stay this way.
Good. So Everyone else use a leg length check in your office? Perfect, right? Easy. It's especially like a re-exam or just like someone's seen for a couple days from one to, if they have like one side type of back pain, they go, okay, what's going on? I use the x-rays too, same thing. If I see the x-rays where they're off a little bit. For me, it's not really a short leg. It's more the hips, what I said on the video, hips being rotated, making that leg look shorter when they're lying down on their back or their stomach. You know, even though with Naomi, I did her on her stomach, I usually have patients, I'm not sure what you guys do too, face up the whole time, because I want to see them, I want them to see me and see what I'm doing, especially day one, right? That allows them to be comfortable for one, but also can talk to them because they can see my mouth, can see my hand motions, they can see if I'm going here, if I'm going here, and what's going on with their back and neck, so they can kind of communicate better, more eye contact. Does that make sense? Some people, yeah, they prefer going face down, which is their normal, but going face up initially for their first visit, you can talk to them easier. They're more comfortable because you can see their feet move, you can see how your body's moving, you can see where your shoulder, if they had a problem, their x-rays where the neck goes forward, kind of point that out to them also. So the exam room versus my x-ray room is different. So I want them to get that reiteration of what we saw in the x-rays or the examination back into the actual treatment floor. So it kind of reminds them what we're going to work on. All right. You ever do, we'll talk about at the very end too, when I first see a patient, I always want to do a posture check with them. You guys do posture checks? No? Some type of people do. Allows them to go, for example, I'll show you at the very end. I'll have, before I do any adjustments, if they have problems where they have poor posture, stand against the wall, heels, hips, shoulder, and head, go just like that, and have them hold that. And I ask them, how does that feel? They go, well, man, because my back pain, I think, my back feels real tight going back that far. Most people, when they have their posture, which is whatever that might be, that's their normal, right? So if that's their normal, they may feel normal just like this. I had someone, Jeremy, that's come in this week. He came in just like this. He goes, that feels good to me. Okay, good. They tried this, he goes, that doesn't feel normal at all. Good. Let's make your normal that normal over time. It kind of gives them a way to understand what's causing their pain may not have happened yesterday, even though the pain was yesterday, but their posture, I explain it this way, has been getting to that point over time for finally building enough pressure to cause the pain. And this is where you are today because of what happened maybe when you started your job sitting so much 3, 4, 5 months ago. So giving them that timeline allows them to understand this is going to get there over time. This is a better normal, optimal normal versus where they are now, so that pain stays away. I think that's the goal with everything, right? Can we get them to feel better so they can start doing more things and over time get even stronger and better so pain doesn't come back? How many of you guys and girls do have exercise with your patients after your treatment? And exercise at all, things like that too? I do them sometimes. Just my extra with them is what I'll do is after I adjust them, if they have, for example, a visual short leg, it gives them stretches for that hip, for the lower back for one too. I want to make sure they have something to go home and do, their homework, so when they come back again the second time or third or fourth time, they tell me how that felt. So my treatment doesn't just end when they leave the office. Mine extends out to their lifestyle, what they do before work, after work. I want to help train them so at that point they know that stretch will help them do their work all day. That stretch will help them after work, so after work they feel better when they go to sleep. That stretching, maybe icing or heating, whatever you want to work with your patients, will help them before they go to bed, so the next morning they feel better. So I'm giving them a way to change their habits to make sure they can feel better long term, not just in my office. Sometimes people come back, yeah, doc, I forgot to do your exercises, that's why I'm feeling bad again. They come in almost guilty. They go, I didn't do my exercise a couple of days, that's why my back's hurting again. Okay, let's get you adjusted, get those exercises back in your routine. At that point, they feel the benefit of the adjustment and exercise. Exercise for me is not a way for them to avoid the chiropractor. Exercise is a way for them to actually get their back stronger. So what we're doing as chiropractic can help them actually get to better alignment. Then from there, better alignment, they can maintain it on their own. Want to get back to a normal, optimal spine, maybe posture, maybe an x-ray for them, so they feel and they know the result of where they were and how they can get to a better state. Okay. Anyone want to get adjusted today? Any adjustees? Good. I'll adjust in 1 second. Okay. But a lot of it is And what I do with exercise, when I show my patients exercises, I send them the videos also. With my patients, with my staff, I have interns in my office from high school, college, pre-chiropractic school too, is I do videos of how to stretch your back, how to stretch your neck. So part of their learning process is not just in the room, because when a patient comes in the first day, what happens over that 45 minutes to an hour with your first patient, with the first day? Are they remember everything? Remember all of it you told them? No, they got medical amnesia. So the video for me, when I send the videos and the exercises, remind them how often to stretch, how often to ice, based on their work schedule. Is it before, afterwards? Is it on the weekends, more or less? I give them a little note, just remind you just when to do that. So that email, those videos are their, I don't want a reminder, but their habit to make sure we do those stretches as often as I would like them to do. How many of you call your patients the next day or that night, that next shift? You ever call your patients? I learned that from my mentor. By calling someone, or this time based on their age, you can send them a quick text message. I have a template on my notepad on my phone. At that point, it gives them that little extra personal touch that you want to make sure they're doing well, right? Easy. I had a patient, Lolita, this week. Older, one of my Filipino sisters. She's probably, I think she's in her 60s. I call her, she goes, hey, hello. She goes, hello, this is Dr. Tony. She goes, hey, doc, what's up? I'm like, and I told her what's going on. I just want to check in with you, make sure. I told her, I want to make sure you're still alive from your first treatment. She goes, ha, 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 ha. Last little bit, she goes, thanks for the phone call, see you tomorrow. But does that give you a little bit of a personal, professional touch to let them know, hey, I care about you. I want to make sure you're still alive. Make sure those stretches worked for you. How did you feel the next day after your treatment? Did it feel sore? Good. Didn't feel sore? Good. Explain why. So my dog is finishing up chemo right now. And a lot of it is, the doctor calls like every week and says like, how's your dog doing? So it gives you that personal touch where even though the doctor is not with you, they're still thinking about you. And when I get a lot of reviews from my office, whenever it is too, I always go, we try to provide a personal, professional touch to your care to get you better. I want to make sure my staff, myself, we follow through with that to make sure we do that every time with our patients. You know, and a lot of it is whatever you can do. We send thank you cards once a month to our patients too. Thanks for referring so-and-so into our office. So that little thank you, that little message to them, again, everyone's different, gives them a little bit, wow, the chiropractor's still thinking about me. We send a newsletter out every month. We try to do every other month. But a lot of it is going to be, that's another reminder, we want to make sure you're doing your stretches, your exercises, your routine. I want them better if they see me or not see me, but when you give someone all the information they can do to stay healthy on their own, what do? They still want to see you because they know that you're there to help them. And once they know that you're there to help them and they're better in their mind, they want to make sure that better stays better. We talked about it takes about 3 months for someone to experience chronic pain. How long does it take someone to feel better where they actually physiologically are better? I do a podcast with trainers, with chiropractors, physical therapists. It takes about 3 months for someone to change their physiology under constant care, maybe even training too, physical training, so their body can actually change a better state of health and they maintain that on their own. Once they get to that state of health, what's the goal? To make sure they know when they don't feel like their health is at that point, maybe 3 or 4 days later, that point come and see you right away. So you're giving them a way to stay healthy in their state of health all the time. That's the plan with what I do. A lot of it is, like we talked about, is not just the adjustment, it's how you communicate what the adjustment is for, the long-term effects, short-term effects, so your body can stay healthy. That's the plan. All right, so sir, come on up.
Oh,
Yeah, you treat it. Boom.
I'll take a freebie.
You take a free, oh, good. Good, I like freebies. All right, I'm gonna have you adjust me afterwards too. It's been a long week. Tony, nice to meet you. Joel, nice to meet you. Where do you practice?
In Tarzana.
All right, okay, a little drive for you too. Cool. What's going on today?
Left hip.
Mhm.
You know, I adjust this thing.
Boom.
The right shoulder's just jacked.
Which one on the shoulder? Drop your stuff on the table too, or your phone or whatever in your pocket. There you go. What's with the shoulder? I tore my shoulder before too. What happened?
I was doing a side
Give me a
posture.
story. Okay.
Patient didn't come all the way over, and I was
frick.
being sloppy, and I was just
Got
just
too far over the
thrusting
elbow?
out, and then
Yeah.
just
And is it more the front or the back?
it was in front. It's getting better.
Okay.
It's getting a whole
How
lot
long ago?
better.
Couple months? Okay,
About 3
okay.
months.
How do you stretch it? What do you do for stretching?
Well, I still rehab this thing, so I
Good,
go
good.
through all the ranges. I got full range of motion.
Okay,
It's
okay.
just
Is it more, you think it's more pec minor, anterior delt, bicipital tendon?
bicipital tendon for
Okay,
sure.
more of this motion, okay,
Yeah.
okay.
So anytime I do like shoulder presses.
You still work out, right?
Yeah, I
Oh
still
yeah,
work
good,
out.
have to.
So, but the day after I do shoulders, this
Rick.
thing's piss. And then I get a little clicking in there. So,
Okay. And how about if you rotate your hand out this way, does that feel good?
not really.
Yeah. So tight,
So
where do you
right
feel
in
it?
there, I feel it tightness.
Posterior delt? Okay, okay. I'll adjust your shoulder afterwards, see if you're okay with that.
That's good.
How do you stretch your shoulder and what do you normally, what's your routine?
Well, I go through all the ranges of
Cool.
motion. So I'll
Good,
go
good.
from here, I'll go thumbs up,
Uh-huh.
lateral,
Boom.
thumbs down.
Mhm.
So I'll hit all those ranges of motion, and then my workouts have been very lightweight. On
Yeah,
these
try to get a
things,
little
so
rehab.
just
It's gonna happen. I tore mine before too, yeah. Do you do this broomstick stretch too, broomstick? That's what I would do. I tell my patients, that's what when I give my patients, broomstick go as wide as you can, go far back where it feels comfortable, hold for 5 seconds, come back for, tell them do it 5 times, hold for 5 seconds. Even resistance band too. And it just takes time, man. You'll get there.
It's gotten better.
Good.
Believe me or not. Over
Icing
the last
too?
few months, it's gotten better. Yeah. Oh,
Good.
yeah.
Isn't it amazing? It works. Been around for millions of years, ice pack. Still works. On your back for me first, face up. You said more the left hip, right
Yeah,
hip?
that left.
Okay,
part,
okay.
That's the one I kind of lead.
You
with.
work solo?
I do.
Perfect. On your back. Get your money's worth today.
But my wife's a chiropractor.
Okay, okay,
She's
okay.
right there, so it's her
There you
fault.
go. It's always her. I'll take care of him for you. Like a little extra for you. So right now, higher, lower. It's a little tighter on that left side. Okay, so as I tell my patients, it would be more of the left hip being here and the right hip being dropped. So you don't wear a lift in your shoe, correct?
I do.
Okay. How do you stretch your hip?
I'll do forward lunges.
Okay.
And then I'll do that rotation psoas.
Perfect.
As well.
Okay.
Pull on the quads. I'll do. No, this is my warm up for
Yeah.
varsity patients, and I'll squat and try to.
Perfect.
Adductors and do side lunges.
Boom. You got it all down. Try this one too, Joel. Bring your leg off the side. Bring your foot back here.
Oh yes, sir.
How's that feel?
Yeah.
This is I call it hip flexor stretch. It gets the quad below the knee, as we all know. Quad attaches below the knee. Hip inside, psoas goes to the below back. Also, hits the side joint back. It's the whole hip to kind of rotate back to neutral instead of being more posterior. I tell them patients going backwards. Just use common knowledge. Easy stuff, right? I tell my patients hold this for about 1 full minute, Joel. At that point, give the ligaments time to stretch. How do ligaments and muscles stretch differently? How would you tell your patients that? I tell my patients muscles need the movement to stretch. Ligaments need that tension under time stretch. So I tell my patients hold this for at least a minute. And what are they going to do for a minute? They're not going to do a minute. They're going to do like maybe 30 seconds. I always give them longer so they give them some leeway to see the actual result, correct? Okay? So I tell them do it at least 3 times on one side. They'll do it probably once. People are lazy. So all I want is once, but I tell them 3 just so they get the one in. You know, kind of work with their mentality, what's going on. So draw at least 1 time on this side. And when you do lower body squats, deadlifts, lunges, do you do a stretch between sets?
I try to.
Okay.
If anything, my favorite stretch is just a forward flexion.
Boom. Okay.
Get the hamstrings.
Get things to drop a little bit too. So I have patients do with something like this to flex your leg, is even to have this, especially chronically, have them go down a lunge stretch and just lean forward a little bit and come back up for about 10 seconds between sets. That's what I do for myself too, because mine is more the right side, is I'll come forward and lean back to feel that 10-second stretch on both hips. So they're working out even not here. For yours, even not here. What happened during COVID when the gyms closed? Did you guys see more people or less people when the gyms closed? Or actually when they reopened? More people, right? Why? People went back to the gym during COVID. They want to go back to that weight they did 6 months ago. So job security, we had more people. The first year after COVID, after the gyms reopened, I saw 23 bad back injuries just from people deadlifting. You know, because they didn't want to start over. So they started with like this too, same thing. They had a bad hip, and all started lifting weights. It get worse, worse, worse. What happens when you over rotate your hips or overextend your hips? Torque on your low back, L5, S1, L4, L5, pops that disc. Boom. Guys and girls, everybody. Not gender specific, I guess. So this will allow someone to get that hip stretch in there, 10 seconds both sides, Joel, to mat that hips to work out even, maybe even cardio too. So they stay here, not here. Helps a lot of people. All right? Anything else?
No, sir, good.
All right, bring your leg up, sir. Do you stretch every day then?
Oh, yeah.
Yes. I get up before 15 every morning, stretch for 15 minutes before I do anything. I can't leave the house without stretching and my cup of coffee. I won't make it to my office. I don't know how to get there.
Gym first, then office.
There you go. Have to. Why is, and there's nothing too, why is staying healthy yourself important? We all know. As long as you want, right? The chiropractor I took over for I bought into the practice, he went out because he had a bad back. I know. We have to take care of ourselves first to take care of our patients. We have to work out, stretch. We have to be the best example for our patients because we do it ourselves. When we do that, does that build up our character, more reputation? Yes. Who wants to come to the chiropractor when they can't even move themselves? No, nobody does. All right, so get adjusted. Enough talking. You have any problems relaxing? You're good.
Okay.
You know if your wife's in the room? It's okay? Okay, good.
She
Right here?
ignores me half the time.
Well, I thought they're all the same. Deep breath in, all the way out. Right here, all the way over. Easy. Deep breath in, all the way out. Piece of cake, piece of cake. Are you guys aggressive when you adjust people? Just move bones? Why do you, I tell my patients I'm aggressive, especially with new patients, because I have good malpractice. I'm covered. You guys have the 1 million, 3 million coverage? You know, it works. They go, that doesn't help me, doc. I'm like, it helps me feel better. You know, it is. You find a way to help relax the patient, and sometimes they'll laugh, and then they go, oh, okay, well, you got to kind of read the room, I guess. Or if you have a problem in the neck and it's consistent, they go, sometimes I'll tell someone, it's probably just a tumor. You know, you have good life insurance, you'll be fine. Crossrooms? Got to find a joke for your patients. Now, what I do too, and I'll show you guys on that side, I always, and same thing with yours too, when I adjust someone, I always use the table to help me. So I'll put my leg on the table, because if I'm here over Joel, what's going to happen? Ow, ow, hamstring pull, okay? Without the table. If I'm with the table, now all the pressure's on my leg, I can move wherever I want to go. It doesn't affect my back or my leg. So use whatever you have to keep yourself healthy for the long run. And I'm a right-sided guy, so I'm going to go right here, Joel. Take a deep breath in, all the way out. There we go. Deep breath in, deep breath in, all the way out. Boom. And which shoulder am I using? Is good shoulder or is bad shoulder right now? Is good one here. Okay, just my head. So I always tell the patient, you have a bad shoulder. I want the good shoulder on top for leverage, not the bad shoulder. I can cause more injury. I don't torture you, Joel. All right, all good. So on your side this way for me. Headrest I don't think doesn't move, so I don't want to mess it up. I don't know. I don't want to mess with it. Right there. Also what I do is have people drop their leg here. What do you think that does, Joel? Rotates you more if they're comfortable with that. So I'm not doing this. I can drop straight down with my own body to get that area to move. And what I do too, because I'm 51, I use more my forearm here on their SI and lower back than a direct contact. All right? I want to save my body too. There we go. Other side for me too. Is that okay?
Yes.
Good. That's all of the pressure on the same thing here. I'm going to put my leg on the table. Leg drop for me, Joel. Good range of motion. Let that foot, if you can't touch the floor, hold that right there. Helps relax the leg, the hamstring, the back. Take a deep breath in. Relax your head for me. Boom, just like that. Good. And then grab a seat for me. Watch that shoulder. Right there. I'll adjust your good shoulder first. Let's go to your left. Bring your left hand to your left ear. Perfect. Good, you know your left and right. I sometimes get confused. Bring your elbow in. Eye contact for the elbow adjustment. Just cup the olecranon process, is that right? Is that right? The elbow. Hand over top. I want to put his shoulder in my chest. I'm going to come straight back. I'm going to hold the pressure first. Take a deep breath in, Joel. Bring your head back for me. There we go. Real simple. Not bad. Sometimes I'll do based on range of motion. I'll bring the shoulder back too, just to cavitate a little bit of that AC joint, just like that. All right? This side a little bit easier. So we're going to test it first. Bring your right hand to your right ear. Elbow in. Before I adjust them, add some pressure. How does that feel?
Good.
Good right there. Take a deep breath in. Real simple, light one first. Right there. Is that okay?
It was okay.
And then up here too. Right here, deep breath in. All the way out. Simple. All right. Work on the range of motion, my friend.
Yeah.
You'll get there. It's just time. You know, I tore mine in chiropractic school.
Yeah.
First quarter. Bench pressing. Stupid. That's it. All right. Any questions?
Oh, good.
Good. All right. Tell your wife to watch your wallet. I don't take tips. Take your wallet with you.
It's empty anyway.
What's that?
It's empty anyway.
Oh, yeah, I know. It makes sense. It makes sense. Any questions at all? It's making your treatments effective, especially your first visit. I tell patients after your first visit, toward the end, I always go, this is your longest visit ever. Because we had to go all the information. I want to make sure you learn everything, make sure you understand, and come back with more questions down the line. I want to make sure we're almost their primary health care practitioner, not just their chiropractor, for whatever else is going on in their life, you know? And you may not have all the answers, but can you help them find the answers over time? Anyone wants to get adjusted? Anybody else? Yet? Not yet? Let me know if you want to. Just let me know at the end. All right, so another video here. Do you ever tape your videos, your patients getting adjusted? Videotape it? Entertains me, especially when I know they're a good one, what's going to happen. So part of my workshops I do with schools, with seniors, talks in my office, I want to make them educational, but also entertaining. Why is entertainment important in your education? They remember things better. They're entertained. They're not falling asleep. All right? You guys have your coffee now, but by 11:30, you're like, I just want to go home. All right, so here is a decent one. Her dad's watching her first adjustment.
Right here. Deep breath in. All the way up. The head drops my hand. One reaction. That hurt me. That hurt me.
Again, laughing. Common reaction. Not Jesus, just Dr. Tony. Jesus. Gotta use that. You can use that one. Copy it.
One more breath. That's all cracking?
And why do kids, they're easy to adjust, right? Kids, teenagers, they're mobile. They adjust easy. Piece of cake easy. It's not that hard. But just being aggressive enough and having I always try to have the parent in the room for one also, unless they come in routinely, because I want them to experience the whole same thing too. They want to make sure they're comfortable with me adjusting your kid. I had a kid, Chris, come in this week, toured college for about 2 weeks or so. I had seen her mom, Sherry Ann, probably about a couple years ago. And it's a simple torticollis, but I still wanted to make sure she understood, because she was very concerned, because she had gone to another chiropractor, took an x-ray, and didn't want to adjust the kid. I'm like, why not? So I'm like, I'm going to adjust the kid no matter what. So I want the x-rays first. Let me see the x-rays. Parents were cool. The parents are more like, just want to make sure everything's okay. I adjust the kid the first time. Kid's like, Mom, I can move my neck. I was like, okay, good. When do I come back? See you Monday. So it's a lot of it giving the parents a chance to be comfortable first, understand. And why do you ever get people that come from other chiropractors that won't get adjusted? So weird. I don't get it. I don't know. I have good in my practice. I'm covered. So I'm going to adjust someone no matter what. If it's, again, what are the red flags of not adjusting somebody? What's the red flag? What's that? Cancer, a trauma with no x-rays, something like that for one too. There's probably a couple other ones also, but osteoporosis, severe osteoporosis for one. So I always want, or even other issues too, where I go, have you checked with your medical doctor? Yes. Are you okay getting adjusted? Yes. Okay, good. Green light, go. So I want to make sure, especially with kids too, parents are comfortable with me adjusting them. And a lot of them are already patients, bring their kids in. Sometimes I get new patients, so it's more of me making sure the parent knows they're comfortable first, and then the kid next. So, and she was easy too. So having someone where you have someone in the room allows you to not only videotape, like I did, but also get the parent comfortable with the kid getting treated. All right, simple stuff, easy. Another one here. This is what I was talking about earlier. This is when someone leaves my office for the first time, I always tell them, take a picture of this, because I want you to read that before you come in next time. And then I'll just read it for you. Beneath every treatment or procedure, there is a life that is loved by someone, a person of dignity and worth, who is unique in the eyes of God. The task of every physician is cure occasionally, to relieve often, and to comfort always. Is that really our job? Simple. Can we make sure the patient always feels comfortable, always, so they leave happier than they came in, even if you don't even treat them? I want to make sure this is part of their care. I had patients come in a couple years ago, as a coincidence, 2 of them really bad low backs. One was in her 60s, he was in his 50s. And I said, you know what, I'm going to treat you for a couple visits. If you're not better, not feelable difference, let's get the MRI. They go, okay. So I treated them, both not getting better. MRI comes back positive for a disc tear for both of them. Both had surgery. I check with them a month later, go, how you doing? They go, better, and thank you for letting me know I need an MRI. So people just don't know what to do. How many people you know, chiropractors especially, they'll treat someone forever with no improvement? Crazy, I don't understand that. I see my rule of thumb with a patient is 2 weeks of care, every other day maybe. Not getting better, we need the MRI. We need something else. We're missing something. I want them better in my office or somewhere else. Again, the goal is make sure this happens every time, much as we can. All right, so this is what I tell people, read. This is before I even came out. I don't even know who this person is. I have no idea. But whoever made that code up, thank you. Thank you, whoever. They're probably not with us anymore. Just saying. So this is more of someone came to my office, wanted to film some videos. So kids, adults, a normal. When we're open Saturdays, our normal Saturdays a few years ago. Just see people and go. Mom in the room. Easy stuff. You wore a tie back then, back in the 90s, I think. 80s. So you didn't even have facial hair back then? You guys adjust someone's face down. You see always the leg kick? The reflex. Just watch don't get hit in the face. Mr. Reed. A lot of headaches. Piece of cake. And now we just moved a couple years ago. Now we have 4. We only had 3 before. So now we have 4, which is great. Just run them. I have a roller table, maybe some ice packs, some meat, and that's it. I don't mean 10 minutes for me doing that. I'm missing 3 people. You know, I want people to get adjusted and get the heck out. He's one of the people that came in the video. Her husband's a little more unique. Let's get it. What's that?
What was the cue that you were using?
So when you about just neck, I go, bring your feet together. Distraction, boom, get him. Just animated. More of a rib. There you go. Triple legs. So yeah. You gotta have fun with your patients, right? So again, we talked about this earlier. How does chiropractic help? Not only just pain, but also sleep, headaches, less stress, posture, pain relief, energy. Help people come in your office when you see them a couple times. Do you ever listen to how they talk? And does their, I guess, perception on life change a little bit? Do they sound better? Do they sound like they're happier? They can do more things. You know, they can feel like things are getting a little lighter to them too. They can sleep better. They have more energy. You know, so I always try to get them to go, do you know what you just said? And I pause. They go, no, what did I say? You actually sound like you're doing better. So it's almost like giving them a chance to verbalize and hear that from somebody else tells them, yeah, I am doing better. And they may see these little micro improvements, but you know long term it can get better too. When someone asks you for example, give them stretches or exercises, and when they came in, we talked about earlier how they hurt their back deadlifting or something like that, and now they can start doing that a little bit here and there, here and there, here and there. Give them the confidence that what they came in for, now get back to the normal lifestyle. So when someone comes to my office the first time, I always want to go, you said you had problem, the last problem, you had this problem last time you deadlifted, last time you exercised, last time you lifted, say, your toothbrush off the counter. At that point I go, I want to make sure that you can do that again in a short period of time. I'll give you things to get there, but I want to make sure we're getting there, so that's going to be our goal. Even though you're in pain, the pain's one thing, let's make sure that cause of pain gets better again. I want to make sure patients understand, especially if they're a little bit older, they do not limit their lifestyle. Because if they limit their lifestyle, what happens? They start doing less and less and less and less just to feel good. Ever had patients come from the medical doctor, especially a little bit older, and they go, well, if it hurts, their medical doctor told them, if it hurts, don't move. Don't do that exercise. Don't do that stretch. Then what happens? Then they get weaker and tighter, weaker and tighter. Then their lifestyle, then they can't even get out of bed. Happened to a patient before. She's in her 60s, came in severe pain, low back pain, in a wheelchair, and bilateral sciatica. So I go, let's take an x-ray and see what's going on. X-ray came out negative. I'm like, where's the problem? She goes, well, same thing, my doctor told me 7 months ago, if it hurts, don't move. Sit down more, lie down more. So it became weaker, tighter, so where she was right now. I said, Rachel, we have to do two things. We're gonna have to move, but you're gonna be in pain. Are you okay with that? And she goes, okay, like in a question mark. So started moving, I see her a week later, she comes in like mad at me because it hurts a lot, but but can you walk now? Are you with your wheelchair, or why are you with a walker now? Well, I can move better. Okay. So I said, so you're getting better? She goes, yes, but it hurts a lot. Sorry. So I go, part of your recovery is going to be uncomfortable and sometimes painful. Now she walks 45 minutes with no walker, no cane, comes and goes, thank you. Because you have sometimes, does recovery sometimes going to be uncomfortable, sore, painful? Yes. We have to make sure, and when I show someone stretch, like I showed Joel a second ago, Dr. Joel, they may go, ow, that kind of hurts. I go, does that hurt or is it uncomfortable? They go, well, it's kind of uncomfortable. Does it hurt to where it wants to spasm and guard? No, it's more uncomfortable. Okay, I want them to understand how we get them better, because we have to get things to stretch and move, get them past what they're used to, so that ligament and muscle can actually get more flexible, more strength, then by then they can have their full recovery. So I want to give them an idea of where we want to push our stretching with, even our exercising to down the line. where it's going to be uncomfortable, sometimes painful, to get to a better state of health. They go, okay. Because someone's in pain for a long time, are they more sensitive to when they want to move or when they're in pain? Yeah, they are. So you kind of want to walk them through, that's okay now, but I want that better. I want to make sure we see the future as being sore, as being good for you. As going where you're sore because you went for a longer walk, more exercise, more stretching, and it was sore. I go, that's good pain. That's good soreness. I want them to experience that again because they've been told sometimes the opposite, like Rachel was. All right. So, and again, how many people come in your office and go, man, I can do more. I have more energy. Pain, yeah, pain's whatever, but I have better posture now. And what do people that work in an office? They go, and I told my coworker Rebecca to check her posture too. How many of your patients become like assistant chiropractors? You know, I told her to stand up straight, get her back up here, or sit better for 1, 2. They go, good for you. Even how about headaches? You treat headaches? Same thing. Can we get them to go away over time? I had a patient. She had headaches. She was in her early 20s. Her mom had headaches. Her grandma had headaches. So what do they think? Hereditary. All hereditary. Can't fix it ever. Do you know what we know the difference between genetics and epigenetics? Epigenetics versus genetics differences? Where epigenetics is more like lifestyle, so more of what they're doing. Because her mom and her grandmom always been on medication, she never knew any different. Started eating better, yoga, taking inflammatories, doing more stretching, her headaches went away. So it's almost catching them an idea of, especially when they're younger, the ability to change their lifestyle a little bit. So even though they have genetic predisposition for headaches, may not have because they're changing their lifestyle. Some may think, I have this because my parents had it. I have back problems with my parents. My doctor told me my parents had it, so I'm going to have it too. I go, okay, do you believe that's true? Okay, well, let's give you different perspective. Do something different. So it's something making sure we're giving someone ability to think on their own, but also give them a different way to think so they can get their improvement too. So same thing, talked about sleep before too. It makes sense to us if we treat the C1, C2 area, occiput 2, calms the nervous system down, the body can actually heal better. Have you ever talked to your patients about sympathetic, parasympathetic autonomic system, how that works? If someone comes with chronic pain for more than 3 months, I tell them, is now your body's in a stress state. So you experience sometimes all these things because now your brain is telling you to stay in that stress state. That's your normal now. We break that cycle with the treatment, with stretching, with ice, whatever it might be, to make sure these things go away because now that stress state is go from being stress state, again, we know sympathetic system, to more of a relaxed state, keeping it as simple as possible for them. And they go, okay, doctor. Right? When someone says something, do you nod your head sometimes too with an agreement? You want to make sure we're communicating verbally with body language. I think we can to make sure that we confirm what they're saying as being the truth, in our sense at least. All right, so next one. You might have seen this guy on TV. I'll go over his story afterwards.
Feel that? Yep. You're good. Okay, wait. I'm gonna set up. Okay.
He's gonna get you ready, relax.
Oh, quick one. Pause. When they both came in, him and his wife, they both want to get treatment. They're nursing chiropractic before. I took exorcism first, adjusted her first. When I adjusted her first, and these rooms aren't very big, he ran out the door. Like, just took off. I'm like, what's his issue? She's like, he's deathly afraid. So I adjusted her first. She was fine. She goes, I said, can we film him? She goes, yes. I'm like, perfect. So.
Feel that? Yep. You're good. Okay, wait.
He's not a small guy either.
Set up. Okay.
He's gonna get you ready, relax. Honey, really, this is gonna be okay. Remember, it's gonna make you feel better.
Turn your head first. Okay. I'm gonna have you go right here. Okay, good. Good. I'm good. I'm good. Oh God. You're moving so violent. That's a lot of pressure. Okay. Now see whether that you're probably. Yes. Come on.
See, I can't
We're done? No, we're not done. We're just getting started.
I'm gonna fall. I got you. Breathe in all the way up. Good right there. Oh my God! Right here. Deep breath in all the way up. See? Easy. This isn't gonna be the easier, no, maybe like the middle easier one. Are you done? Not yet. Go back. Okay. Hold on your shoulder and on your hip facing this way. Find your side.
He's all damaged.
This is nice. This is the part that you want me to do for you.
Okay. Right here. Bend your arm up. Right here.
Oh God, oh God.
Right
I'm
here.
gonna stretch.
Right there. Real easy, right? Deep breath in. All the way up. The shoulder relax.
Oh, wait.
Right there.
Did anything
Oh,
pop?
okay. Right there.
It did?
Yeah.
Okay.
Is that okay?
Easy one.
Still
A second. A second.
Oh, son.
Ugh, he's exhausted.
Great when it's edited. So great.
Good.
Say hi, honey. Relax.
Speak up, Jim.
Oh,
Breath in. All the way up. You can get that back for me.
is that?
Yep. That's the one.
Is that the one that I can't get?
Okay. How's that?
He's exhausted.
Good. Let's stand up, see how you feel. Deep breath in. Stand all the way.
How you doing? How's your back feel?
Head still on.
It's
He's
okay.
not a small guy.
Good. How's the pressure feel in the neck, mid back, and low back?
I better in the back.
Really?
Lower back, yeah.
Not as good.
It was locked up before.
Yeah, yeah.
You can lift your knees. Okay, legs. Okay, that's good.
Oh, wow, man, look at that.
That was a happy camper.
Oh,
You see
you
that?
practically what you want
Look
to.
at this. You see that?
Oh, there you go. Look at that.
Oh,
I'm telling you.
sorry.
This is you. This is you. Feel like
Creepy, I'm sorry.
just normal reaction to your body. It's all.
That's like he has to duck down and can't even fit through the door.
Thanks, doctor.
You may have seen him as in a recent, what's it called, Super Bowl commercial. Last year's in the State Farm commercial too. So he does a lot of acting stuff. So you're gonna get some patients like that. It's gonna happen. If a patient screams, do you freak out? No. It's a part of the reaction. No, they're like, what's going on? I'm like, I don't know. I'm like, these people ran out of the office. They're like, I'm not going to see these guys. Exactly. Yeah, you have a free office for the rest of the day. You're good. But something like, if someone does that, it's going to happen. I had one patient. He a real nice guy, but he would always like curse. Like when I treated him, his wife's in the room too. I'm like, hey, don't do that. I have Sister Mary next door in the other room. She can hear you. He goes, no, you know. I'm like, yes, I do. So, and she wasn't Sister Mary. She was an older lady, had like the long dress and everything. So I put her on the table first, and she can't hear very well. So then I put him and his wife next to the table because I roll tables in my office way to kind of ice down and relax after the treatment. And I tell Sister Mary, because she's not Sister Mary, Anne, I go, Sister Mary, how's that feel? Okay, and the wife goes, slaps him like, I told you, he was right. So you almost like got to trick your patients sometimes just to behave themselves in your office, you know? But again, I'm going to have fun myself too at the same time. So again, as my office, Hippocrates, we know that for sure. Boom, boom, boom. Does someone come and tell you ever that they come in because, or they're coming in your office because they have chest pain? And what's my first question? Have you seen your cardiologist? Has that been cleared? I want to know that first, right? Before you're in my office. You go, yes, I get this because why? Because when I feel stressed, my pain goes here. Can that happen? Yes. So what we do, we want to make sure we link their stress to their pain in their body. Physiosomatic reflex, right? Pain can happen anywhere in their body, their knee, their back, their organs for one also. I had a patient before, she had driven from where we live, City of Commerce, which is, if Tarzana people, LA is LA. Traffic is 2 hours, sometimes 2.5 hours, each way. So what was her issue? Stress. What was her problem? Chest pain. She goes, either I come here or quit my job. So I said, we're going to start getting you adjusted, but make sure at lunch you start walking. Make sure we change some of this in your life. So you come home it was like this time of year, so longer days, Come home from work at 5, go for a 20-minute walk with your husband. Do some stretches. Get in bed by a certain time. So lifestyle changes, so over time, this goes away because the stress goes away. So linking things for them allows them to see the benefit of chiropractic short-term and long-term, right? So then she's still working. She's not having to retire at 45 years old. You know, how many times you get a patient from your office, they're told from their medical doctor, your stress is going to kill you, quit your job. Leave your family, kick the dog out, whatever. You go, is that practical for people to do? No. So how do you lower their stress level, or once their stress is better, make their body stronger to handle their stress? How does that work? Lifting weights, exercising, moving things around. When you get to that point with them, they go, I tell them, can you get back to your exercise again so that becomes so you stay pain-free? Helps your mind too, right? Helps everything. I work out because I don't want to kill somebody sometimes. Look at the gym. All right, so another one here. You won't see her very well, but you'll hear her pretty well, Miss Claudia. Every time she comes in, every time she gets adjusted. Not the first time. Takes like 5 minutes to adjust her. Takes forever. Is that cackling? They call it cackling? You know what it is? Now, we'll leave the door open for her too, because what are people in the other room thinking, right? What's going on? She's laughing so much in there. Every time. And 1, 2 left. Every time. It's like her normal reaction. Okay, so this is my office. It was there before I came in. And my office has been in a chiropractic office since 1986, which is a while back. So it says, even if it isn't the best day of your life, why not pretend? Why is that good, bad, and different? I don't know. It just, can we change this to make sure, if this isn't right, part of when I talk to coaches, do podcasts with coaches, mindset coaches, life coaches, they want to focus on this first. If we don't change this, they're not going to do their stretch, not going to do their exercise, not going to want to get better. So we want to make sure we help them change their mindset first, then they can actually do the things in their own life to improve. Stretching, icing, working on their posture for 1, 2, get in the office one also, show up. Sometimes you have patients that don't show up all week, your staff is calling them and go, I just couldn't get in today, doc. Go, you're not even working. Get off your butt and get in there. So I want to make sure we change your mindset first, give them a way to change that. So at that point, I give them a card that says, if they're like, they're way out of it, I go, here's my card, read this every day. This is your mantra every day when you get up in the morning. Do this and you'll get better. Don't even see me. Just do it. They'll still see me. It's reverse psychology. Don't even see me until this feels like part of your life. They go, okay, I'll see you tomorrow. Perfect, got him. You know? So almost a way to change this first, in a sense, so do the stretches, exercises, get themselves better. So I want patients to learn, I'm not going to be your chiropractor for life, because I'm going to die sometime, but not yet, hopefully. But I want to make sure you have good habits to keep yourself healthy. I want to make sure they know they're their best doctor. They are their best doctor. So they learn how to take care of themselves, maybe with their back pain, neck pain, their sleep, everything else too. So they continue to learn. Because once someone feels better, what they're going to do? What else can I get? How else can I stretch? Should I start working out again? Should I get a trainer? They want to get better, 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 better. But you have to give them that first initial kick in the butt sometimes, or a little push to make sure they can get to that point. Right? Once they start sleeping better, they go, man, I slept better. Good. Now what else can we do? What else can we do? Give them that little bit of a nudge to get the improvement, that little carrot. Right? Another one, I want to get that my last one eventually. Who has a spine in their office? Good, bad, and different? Piece of cake, right? This is what your spine looks like inside. Scares some people, but when I take their x-rays not, doesn't matter. I always use these bones to explain how the bones should move, how this facet should move, how we should move, how yours might be locked up here and there. Why the disc is degenerated, because you have a lack of motion. So again, depends on where they are mentally, where they are. I want to walk through what a normal should be, where you should be, how we're going to move things around. And once you move the bones, then ligaments, muscles can lengthen to give that free range of motion. If we have better motion in our spine and our ligaments and muscles, what happens? We can get stronger, have more endurance to sit, stand, move around, not feel sore in the morning or at night. So walk through all of this at an obviously slower motion, so it connects with their pain, lack of motion in their spine, better ligament and muscle length, and then better and less pain. From that point, more strength and more endurance. All right. If some people say I can sit for, your patients say, sit for about half an hour and then it starts to hurt. And they go, let's build more endurance up. Let's move things around so you, long term, your stretches, your exercise get your body feel better for, sit for an hour, 2 hours, 3, 4 hours, 4 hours. So build up that time over time, obviously. All right. Another one, too. This is probably the last one, I think. Mr. Jack. Again, how many people have dramatic patients in their office? I do. I don't want to have so many. Every time. I had a joke with him. Can sometimes pain be good? Yes. I've seen him many times, so I knew it was just him being dramatic. Yeah, Jack used to go to the ER probably twice a month because of his back pain. Don't grab my leg. Don't touch me there. Ugh. It's exhausting.
I feel relieved. I feel, I think I'm still gonna.
It's going to be muscle spasm, but not the joint loss. When it calms down, the muscle relaxes. Now the muscle is not
So when I pick this one up, I'm good.
That's to get stable so your left side. So your job today is focus on some stretching. If I see it feels good,
Yeah.
keep your body to sleep tomorrow morning. You control only 100%. You had this one in the bulge of your hips, so you had that sharp pain. Now it's calming down. It'll kind of get to where the spine does unlock completely, so you can get that kind of sleep. So you just have to stay careful.
Yesterday was bad. Yeah. You know, so I felt I was able to sleep today a little better.
Yeah, even his wife has my phone number to make sure that he doesn't go to the ER every time. You know, it's almost like she knows, and sometimes those people can see you better than you can see yourself. He goes, yeah, you're no ER, call Dr. Tony. Go see him tomorrow. And it's almost like making sure they know where to go. So I had one patient, even besides him, he came in on Monday a few years ago and left mad. I'm like, what's your problem? Why are you upset? Like, because I went to ER yesterday, spent 3 hours there, didn't help me, got some meds, didn't help. I came here, spent here for 10 minutes, and now I feel better. I go, yeah, I told you last time. Like, yeah, I'm going to do that again. So sometimes their reaction is ER first, urgent care first, especially the weekend when we're closed. But they know, okay, I shouldn't have done that. They learn over time, right? Okay. This is I do a podcast. I have some people that are been chiropractic before too. If you're one of my show, let me know. I do anything on health. Right now I'm booked, I think, through till the middle of August. But a lot of it is, I want people, why do I have a podcast? It's more of getting the message out that we're healthcare practitioners, advocates, not just chiropractors sometimes. I've done well enough. I've been practicing for 22 years now. It's almost like paying it forward when you do other things like that, I think, because you've done okay. So I had someone who, she's in South Beach I saw her do my show on Wednesday. I do them on lunch breaks only. She's in South Beach, which I guess is a hot. Have you been to South Beach before? Florida? I've never gone. I don't know. She goes, it's a hotbed for famous people and actors and boxers. Actually, she trains like Mike Tyson still, like Holyfield, Mayweather, Matt Damon, all those guys. I'm like, I don't know. But it's almost like getting people from different parts of the world. You've had people from Europe, from Australia, those places like too. It's almost like getting people different perspective, what's going on in life to help your patients, but just content for me. You know, even this stuff too, it's almost like the more content you have, more it builds up your reputation up that you know what you're doing, I think. Besides just chiropractic. I don't just go, come to my office, $59 here, blah, blah, blah. I don't like to really do sales. It's more just what we do to educate our patients, I think. That's the key. Maybe in person, on YouTube. I have people that come to my office, are you the YouTube doctor? I'm like, yes, that's what I do. You know, I'm not even famous, but this is what I put videos out there to help people understand what's going on. All right, so here's all my information, blah, 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 crooked spine, all the stuff too. One thing I want to show you, did a video this last week. Where are we here? Here. You exit out of that. You go to where's my cheetah? Let me ask her real quick. Give me 1 second and have her pull that up for me. Did a video on Friday or Monday. Veronica? Give me 1 second. Second. Pull it up from my drive. If it comes up. Do you guys have fun with your patients? Do you have fun? Gotta have fun with them, man. There he is. There we go. Here we go. Here's one I did. Da-da-da. Open. Here we go.
Contest is for your next visit will give you half off.
How do you blow it up? I'm a Mac guy. There we go. No, that's closing it.
Contest is for your next.
How do we get it bigger? There we go. Nope. No. And then how we put it on. You can see that or not, I don't know. I don't know how to connect the other thing. I don't know. Tech savvy, but not tech savvy. Okay. I'll show it this way. Yeah, it's not playing right. Oh, here a second. Alright. I don't know how to put it on the screen. I'll show it in a second. No, it's not going to work. Yeah, who knows? Yeah. So I did a contest. I don't know if you guys saw it on Instagram, where it was almost like a copy of something else too. Where I said if you throw this tissue box or something, it doesn't have to be anything inside a little basket, right? I'll give you half off your treatment today. They go, half off? That's great, doc. So as they go to throw it, what do? Smack the fucking other hand. Go pay your bill. You know, you gotta have fun with your patients. You know, that's. Again, you got to know them first, obviously. And I try to get them with a family too, so the family sees me do it, so they laugh also. Any questions at all? Getting close to lunch break or break. We have 10 minutes or so. One thing is too, when you see someone often enough, how do you get them to understand why they should see you? Why do they come back? I always ask them, I saw someone, Miranda, was it Monday? I had seen her for a couple years. I go, Miranda, why do you keep coming back? He goes, well, doc, you told me if I have this pain for a couple days, come and see you. I'm like, that's exactly it. So again, training your patients over time to understand the benefit of what we do allows them to really get the point of you're their healthcare practitioner, not just their chiropractor. You know, we all have our own things going on too, but a lot of it we have to take care of our own bodies. So when you take care of someone else often enough, like we do ourselves, we know our own medicine cabinet, if you want to call it that, to get ourselves well. And by doing that, having their chiropractic, you're as their chiropractor, at that point you get to see them often more and more to see their life improve over time too. That patient, even Robert came in yesterday, shoulder surgery, full shoulder surgery. He worked, retired law enforcement. I saw him yesterday. I go, Rob, how you doing? Good, but I have this going on now, and this going on. So it's almost like they come to you for other problems, not just the original problem they came in with, to make sure you can be their first doctor to tell them exactly how to help themselves. Go, what did the doctor say? Well, I haven't gone back yet. Robert, we talked about this. Go see your doctor about that stuff going on. I have this pain down here. Sounds like your appendix, Robert. Go see your doctor. I always tell them too, well, I'm going to call Marilyn your wife. He was like, no, don't call Marilyn. She'll get mad at me. So I always say, what else can I do to kind of motivate you to get over there? So sometimes you're going to see things that are not chiropractic related. We know this. How do we make sure you get to their doctor? I had him come in, same thing. Robert, same guy, come in about probably a year and a half ago, and just didn't look right. You know, you get those patients like just doesn't look right. And I'm like, and his wife was there too. Marilyn, I go, Marilyn, are you guys going to dinner after this? They go, yeah, just Wednesday night dinner when I see you. Go, don't go to dinner tonight. Take him right to the ER. ER, he had he had a stomach, he had an obstruction in his intestine. And it just didn't look right, looked pale. I'm like, it's not himself. When you see him, you almost have to make sure you read your patients well every visit. Not that you're liable, I don't care about that stuff. It's more about helping that person get to their health emergency, if you want to call it, when it's needed. Same thing, I had a patient, because I think I get x-rays in my office, came in a few years ago, and he had a mechanic in his 30s, young guy, I say young, but bad low back. What was the red flag for that, though? That said you should go to the ER. Took his x-rays. X-rays not good, but he had not gone to the bathroom in 3 days. Is that an emergency? Yes. They're not going to know. So then I have hospital about probably half a mile away from my old office, right at the ER. His girlfriend called the next day, he had surgery last night. Perfect. Had broken his back, sacral plexus just destroyed. Boom, 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 surgery. Better, but I'm not going to help him. So getting those cases to where you can get those red flags, I don't call it in your head, but read them well, so you get the right emergency situation if you can, as soon as possible. It's all going to happen to all of us. You know, you don't want to miss something that could help that person, because sometimes it's a timing thing too. You know, ever had someone come with meningitis before? They're not very common now. We're really stiff neck, sometimes teenager, sometimes even younger too. So reading and going through the process of infection. What are they taking for 1, 2, blah, 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 to make sure you get the right doctor. You know, fractures sometimes also. So I had someone fall off a ladder, same thing. What happens? Broken wrist. Boom. ER, go get it fixed. So giving them that, sometimes just giving them the right advice where to go, because they're coming to you first because you're already their chiropractor, allows them to go, okay, now I confirm what I should be doing. Because what happens, especially with guys, what do guys want to do? They don't want to go to the doctor. We're the worst. So you want to make sure, especially guys, because I'm a guy, at that point, I know what's going on. I'd probably do the same thing, but you got to do this. And so I want to make sure they get the right care. But it's almost, what's the biggest problem, I guess, right now with healthcare in general? It's the waiting time. I tell them, can you make an appointment get the MRI? You go, yeah, I talked to my doctor, I'd see him first, see him in 3 weeks, and then I'm going to go I'll see the specialist, then get the MRI in probably about 5 years. So they're coming to you for help today. Can you help them today? Because you're going to be the better doctor, because the timing can be helped today, not waiting 2-3 weeks for the appointment. Now, some people could die before they have their appointment. Crazy. So giving that, or they say, well, if you don't want to wait, go to urgent care, go to emergency room, wait 4 or 5 hours. No, it's like more torture. But that's the biggest thing is, can you help someone today just to feel good? Sometimes just the comfort level, they're in the right place, and from there get the body better, and over time make their overall body feel better and stay better. How many patients do you have come in the next day and go, man, I'm more sore than before? I feel like it's more painful. What do you tell them? Like, oh no. Or do you tell them, well, that's good? I tell them that's good, because now we're moving things around. We have to move things around to make things get better long term. When you say it with confidence because you know what you're talking about, at that point they're going to be helped long term. That's the plan. All right? Any questions, all comments, concerns? Was that entertaining at least? You guys had some fun?
Yeah.
All right. Go take your break. Get out of here. Have a good day.